Hey future sonographers! Are you dreaming of a career in ultrasound and wondering how to get that prestigious ARDMS credential next to your name? If so, you're in the right place. Today, we'll be breaking down exactly what it takes to become ARDMS certified and what you need to know before you even start your journey into the fascinating world of ultrasound imaging. So, what exactly is the ARDMS? It stands for the American Registry for Diagnostic Medical Sonography, and it's the absolute gold standard for sonographers. Holding an ARDMS certification is like having a key that unlocks incredible opportunities. It proves you have the skills and knowledge to perform high-quality ultrasound exams in various specialties. We're talking about everything from OB/GYN, where you see the miracle of life, to abdomen, vascular, breast, and even cardiac sonography, where you're helping diagnose critical conditions. This certification tells employers and patients that you are a true expert in medical imaging. Alright, so how do you get there? The journey starts with meeting the prerequisites. To qualify for the exams, you'll generally need to have completed an accredited diagnostic medical sonography program or have significant clinical experience. Once you've checked that box, your first major hurdle is the SPI Exam. That stands for Sonography Principles Instrumentation. This is the foundation of everything. The SPI exam tests your understanding of ultrasound physics, how sound waves work, the principles of Doppler imaging, how to optimize your images, and most importantly, patient safety. It's a challenging test, but mastering these concepts is what separates a good sonographer from a great one. Once you've conquered the SPI exam, congratulations, that's a huge milestone. But you're not done just yet. The next step is to choose and pass your specialty exams. This is where you get to focus on the area you're most passionate about, whether it's abdomen, OB/GYN, or vascular technology. After you pass a specialty exam, you officially earn your ARDMS credential. Your name gets added to the ARDMS directory, which is a massive accomplishment and a proud moment for any sonographer. You are now a registered professional, ready to make a real difference. Now let's talk strategy. How do you prepare for these exams? You have to study smart, not just hard. My biggest tip is to dive into ARDMS practice exams and mock tests. These will help you get used to the question format and timing. Watch ultrasound physics videos to visualize complex concepts and use flashcards to drill key terms and principles. But here's the most important advice. Don't just memorize facts. You need to truly understand why you rechanging a setting on the ultrasound machine and how it will affect your image quality. This deep understanding is what will help you think critically during the exam and in your future career. So, what happens after you're certified? This is where all your hard work pays off. As a registered diagnostic medical sonographer, you'll be qualified to work in a variety of settings like hospitals, outpatient clinics, and specialized imaging centers. It's a career that offers a fantastic salary and incredible job stability. But more than that, it's profoundly rewarding. You'll be on the front lines of patient care, using non-invasive technology to provide doctors with the crucial information they need to diagnose and treat patients. You'll be a vital part of the healthcare team. If you have a passion for medical imaging, a desire to help people, and a love for technology, then becoming an ARDMS certified sonographer could be the perfect path for you. Don't wait, start preparing for your ARDMS ultrasound exams today. Thank you so much for watching. If you found this helpful, please give this video a thumbs up, and be sure to follow our channel for more ultrasound education, exam tips, and career guidance. We'll see you in the next video.